Welcome to the news update on television Nigerian. I am Chiwando Osisiago. President Muhammad Buhari in Tuesday traveled to London, the United Kingdom for a routine medical checkup as announced on Monday night by the special advisor to the president in medium publicity, Femi Adesina. Before departing the country for the UK, President Muhammad Buhari met with the security chiefs in the morning for briefings and is expected to be back in Nigeria during the second week of April 2021. President had embarked on several medical trips between 2015 and 2019, and during one of his trips in 2017, he spent 103 days in London with the Vice President Yemi Osinbajo acting as the president. The Chief Executive Officer of the National Drug Law Enforcement Agency, Brigadier General Muhammad Buba Mawa, retired alongside directors and officers at the national headquarters of the agency in Abuja on Monday, subjected himself for drug integrity test. A statement issued by Director Media and Advocacy Femi Babafemi said officials were taken unawares when, upon resumption, the gates to the headquarters office were ordered shut and everyone asked to gather in batches at the conference hall, where a team of medical doctors specialized in addiction discharge was already assembled with the equipment for urine drug test. The test results already released by the medical team show that General Mawa returned negative alongside with the secretary to the agency, Barrister, and other directors at the national headquarters of the NDLEA. The lingering friction between Kogi State government and federal authorities over the management of COVID-19 pandemic and its vaccination appears to be over, as the state will take possession of our consignment of the vaccine on Tuesday and thereafter begins its use without further delay. The State Commissioner for Health, Dr. Saka Aruna, reportedly confirmed the report, stating that the residents will be given unhindered access to receive the vaccine, while it is, however, unclear whether the state governor, Alhaji Yaya Bello, and other government functionaries will take the vaccine. The state governor had, in a viral video, rejected the vaccines, having repeatedly cast doubts about the coronavirus pandemic, where the state boycotting every activity linked with the management of the pandemic in Nigeria. The Bauchi state government has paid the sum of 320 million naira as counterpart funding in its effort towards enhancing effective primary healthcare delivery services across the state. The state director of URA's aid-funded integrated health program, Dr. Al-Azhan Siaka, who disclosed this while facilitating the media engagement in healthcare delivery workshop held in Misau on Monday, said with such commitment by the state government, the objective of the project would be achieved. Siaka explained that development partners, including USAID, UNICEF, SIDA, Dangote Foundation Bill, and Melida Foundation and others, have pulled together the sum of 5 billion naira, which will serve as technical support for the implementation of the program for 2021-2022 period. The IHP State Director commended the Bauchi State Government for its commitment and effort toward making quality healthcare services available to the citizens. The African Union and Johnson & Johnson have signed a historic COVID-19 vaccine procurement agreement for 400 million doses of the single-shot vaccine. The vaccine procurement agreement signed on Sunday was expected to allow all AU member states through the African Vaccine Acquisition Trust set up in November 2020 under the chairmanship of President of South Africa, Cyril Ramaphosa, have access to 220 million doses of the Johnson & Johnson single-shot COVID-19 vaccine, with the potential to order an additional 180 million doses. Most of the supplies would be produced at the giant pharmaceutical manufacturing plant in South Africa operated by AS Penn Farm, while the transaction was made possible through the $2 billion facility approved by the African Export-Import Bank, which also acted as financial and transaction advisor, guarantors, instrument payment advisors, and payment agents. The vaccine will be made available to African countries through the African medical supplies platforms over a period of 18 months. And that's the news update on television Nigerian. I'm Chiwando Osisiago. Thanks for watching.